Welcome to Skin Sense. I'm your host, Jeannine Mazurkiwecz. We're back here at Dermatologist with Dr. Steve Schleicher, and we're bringing you a brand new show, one that is very popular, especially with the weak economy, right, Doc?
That is correct. And what we're doing today is a Botox procedure.
Okay.
And Botox, yes, it's very, very popular. As a matter of fact, last year alone, there were some 5 million Botox procedures performed. That's a huge amount, and that represents a 10% increase over the year before.
And we don't want to ignore our guest. We have Dana Muck, and she is going to be getting the procedure done today. Thanks for being with us.
Oh, thank you for having me.
We'll get to you in just a moment, but there are some questions. I'm new to Botox as far as getting it done myself, and you'll see in our SSP TV Skin Sense Extra, if you go online, that I actually got the procedure done here today. So if you want to see that, you could just go to our website at ssptv.com. But getting back to the questions, you know, I was skeptical, thinking, can you be allergic to it? Am I too young to get it done? Do you need to have a lot of wrinkles? Does it affect you if you smoke? So if you could answer some of these questions for someone out there who's looking into Botox but isn't 100% certain that it's for them.
Right. And again, millions of procedures are done every year. Mm-hmm. So we know it's safe, obviously. And the incidence of side effects are extraordinarily rare. And when we mean side effect, we may mean a little bruising, where we use a very, very tiny needle. And of course, we all know a bruise is temporary, may last a week or so. And the other thing that can happen with Botox is you can get a little drooping of the eyelids, okay? Again, that is temporary. It happens in about 1% of the individuals who get Botox. But the nice thing about Botox is it's not permanent. So if you get anything that you don't like, well, it's going to be gone.
And how long does it last? And
that's another good question. Botox lasts in general anywhere from 3 months to 6 months. The average is about 4 months. So people should, in all likelihood, get their Botox, retreated every 4 months or so, which is 3 times a year.
When you're looking at who should get it done, is it someone with a lot of wrinkles? Is it a certain age group? What do you look at?
Well, a lot of it's personal preference, okay? In today's society, people certainly want to look young, okay? So we now have 20-year-olds, 30-year-olds who insist upon getting Botox. Mm-hmm. The nice thing about Botox, the more you get, the more you train your muscles so that they don't frown and so that they don't crease. Okay, and that's what we use Botox for. We use Botox for frown lines, for crease lines, and we should make a very important distinction, because certain lines, which are called static lines, whereas these frown lines are called dynamic lines, well, static lines can be caused by sunlight, can be caused by cigarette smoking. Those lines aren't helped as much by Botox. For those lines, we do other things. We do things like microdermabrasion, facial peels, lasers.
All right, so if you're a smoker, does this last less time if you do smoke?
It's an excellent question. Theoretically, no one's really done any studies with smokers, but theoretically it probably would last less of a time, okay? Because smoking, there are 1,000 ingredients in cigarette smoke, and many of those ingredients actually will destroy or break down collagen.
And another question is, does it matter if your skin is oily, if your skin is dry, or does that have no effect on
that has absolutely no effect as far as Botox goes.
Okay. So you could have 1 line or you could have 100 lines. You're still a candidate for Botox.
Yeah, and Botox, it's important to realize that most of the Botox that's used is used for the upper part of the face. Mm-hmm. Okay, and these are the so-called frown lines. We use it for crow's feet as well. Okay, and some people, whether it's genetic, or some people obviously worry, and worrying and wrinkling your face and stress, sure, that can contribute to these lines as well.
What about being allergic to the product? What actually is the chemical that is being injected into your face?
Yeah, to my knowledge, there's never been an allergic reaction to Botox. Okay, what Botox? It's actually made from a bacteria. Mm-hmm. Okay, so one of the problems that has happened in the past is people have used phony Botox, and there have been a lot of news headlines where people have run into very, very serious problems because there's some greedy people out there, and it's not that difficult to make Botox up in a lab because it's produced by a bacterium. The problem is you want to make sure that you use Botox from a reputable company. And there are 2 companies right now approved to produce and manufacture Botox in this country. Allergan received their approval in 2002. And Medicis, which is another pharmaceutical company, just received their approval for a Botox-like compound called Dysport or Dysport.
Okay, so make sure if you're thinking about getting any procedure done to know all of the information, and that's what this show is all about. Botox, really the new facelift of 2009 and 2010, non-invasive.
That's correct. And you know, that's one of the reasons why it's so popular, because we all know facelifts are very, very expensive. And with today's economy, coupled with the fact that people want to look good, and nobody wants an invasive procedure if they don't have to get one, well, that all lends credence and lends popularity to this procedure.
All right, we're going to get to Dana's story. We're going to take a quick break, but you're watching Skin Sense. I'm your host, Jeannine Mazurkiwecz. Again, if you want to see the extra with myself getting the procedure done and my mom, Debbie, go to ssptv.com. We'll be right back. You're watching Skin Sense. The topic today is a new one for us, and that's Botox, something that is really the rave across the country. And I'm here with Dr. Steve Schleicher, and we're going to be doing the procedure today on Dana. So Dana, thanks for being with us today.
Oh, thank you.
And before Doc gets started, I guess just so everyone knows some background about you, and if you've had the procedure done before, just give us some background on yourself.
Sure. I actually am lucky enough that along with being a patient of Dr. Schleicher's, I work with him as well.
Okay.
I have had the Botox before, I believe probably 3 or 4 times, roughly 6 months to a year in between each. I will say that it doesn't hurt, as you probably know now. It's a very, very small pinch, if you will.
Right.
And never had any bad reactions. I think the results are incredible, and I'm anxious to get it.
All right. Well, I don't know. You said one thing in there. I don't know if you're lucky to be working with Doc, but I have to pick on him. He's always picking on me, so I have to. You know, if you've seen the show and see, I'm always the guinea pig or the one being picked on, so we have to pick on him a little bit here today.
And notice she's strapped down, so she couldn't move if she wanted to. So that's
well, she has to be nice. She's getting this procedure done, right, Dana?
And he's ready to pull out a needle about 10 inches if I don't be nice.
There you go. All right. So tell everyone at home what you do. You're coming in and take a step-by-step through the Botox.
And that actually brings up a good question. How big is the needle?
Right.
Well, the needle is really tiny. Okay, it's about the tiniest needle you can get.
Right.
And what it feels like is like a little mosquito bite. Okay, when you get the Botox. If that, right. And basically what we do is we inject the Botox into the muscles that need it. And these are the muscles up here and through here where people get frown lines, get creases. And what Botox does is relaxes those muscles. And then by relaxing those muscles, that helps take away those creases.
And just to re-emphasize, if you're just tuning in, the Botox, and we did a show on fillers, which I had a lot of people comment on. The filler is used more below the nose, and the Botox is used above the nose.
Absolutely correct. And we get asked that all the time. Well, I have these lines here. Can I get Botox? Well, no, you can't get Botox for those lines. You do fillers for those lines. Okay. There are certain lines down here and little creases here that Botox can work, but you have to be very careful using it there. We're asked all the time about so-called smokers' lines up here. Botox doesn't work for those. So you wouldn't even want to think about that.
All right.
Okay. And then, Dana, what we do is we tell Dana to frown, because then we can see which muscles we want to work on. And you can see these are the muscles here. And what we do, for purposes of the show, we'll actually mark out where we're going to put the Botox.
Does it hurt yet, Dana?
Not at all.
If this hurts, we're in trouble. That's all I can say. We're in major, major trouble. So these are the areas where we do the Botox.
There's a lot of marks going on there.
We have her scared already.
You haven't been here for a year.
Right, she hasn't been here for a year, which brings up, a good question. How often do people get it repeated? And by and large, I would say every 4 months. But over time, you actually train the muscles so that you may only need it 5 months or 6 months of the year. Okay, this is the syringe that we use. This is the little tiny needle. I mean, this is a very, very, very tiny needle. Okay, and I don't know how close up we can get, but it's a real tiny needle.
Right.
All right, so that shows you that. And then one of the things I'm always asked is, you know, how much does Botox cost? Mm-hmm. Well, a little tiny vial of Botox costs the doctor close to $600.
Okay.
Okay, and you saw the vial. We have one here. We'll show you what it looks like. But it's very, very tiny. So it's expensive. It's expensive from the manufacturer. One of the things that was hoped was that when other manufacturers came into the scene, came into the picture, perhaps the price will go down. And that's what we're still hoping for. Okay.
And so, Botox is relatively new, right?
Well, Botox was approved for cosmetics in 2002.
Okay.
And, you know, as I said, there have been millions and millions and millions of injections since then. So, and before that, it was approved for medical uses way back in the 1990s.
Okay.
Okay. So it's not like it's real new. And the only thing that's new is other companies are getting into the action,
right,
because it is the most common cosmetic procedure.
Right.
And even though it's a very mini cosmetic procedure, which is great.
Okay.
And then what we do is we inject the Botox directly into the muscle, as we see here. And you hear the screams, so it hurts a lot.
How are we doing, Jeannine?
Wonderful.
Okay.
Yeah, and there we go here. Now, I might add, we do guys too, okay? And guys usually require more Botox. Why is that? Because their musculature is thicker. So some guys will require twice as much Botox to get the desired result.
I guess that's a good question to ask as well, is does this, obviously people's skin reacts differently to the Botox, so it might take better to the...
And there are actually very, very rare exceptions where people just don't respond to Botox. It's extremely, extremely rare. Okay, so, but most people respond, and when they do respond, it will take approximately 24 to 72 hours to see the response.
And why is that?
Some people respond rapidly and some don't. It's thought that the more you scrunch up your face and make faces, I wouldn't do it in public, but
like,
you know, at
like
home,
I've been doing the whole show?
it will actually make the Botox work faster. And as a matter of fact, some people feel that the new Botox, so-called Dysport, it's not really Botox, it's the same.
Good, I have a question about Dysport.
Yeah, it's some people feel it may work a little bit quicker, but I mean, what's a few hours? You know, if you ask me, I don't see that as being very much of a side.
Tell me about this Dysport. I know that I had some questions, and I asked my friends on Facebook, as I always do, if anyone tried Botox or knew anything about Botox. And my one friend, she's in her 30s, said that she tried Dysport, and she loves it.
Yeah, and Dysport, it's really it's basically the same ingredient. Okay, it just, you can look at it as being a different formulation.
Okay.
Okay, and again, some people feel it may work a little bit faster, and it has a different molecular weight is what it boils down to. But most of the doctors feel that they're so similar. You know, we just hope the prices go down with both, and that will benefit the consumer, of course. So Dana had her injections.
Okay.
Now
I'm going
to get a little bit more, and we're going to do these crow's feet here.
At least he's telling you. Wait until you go online and see mine. He doesn't even tell me what he's doing.
Well, that's because you would have definitely...
I'm just going to fix this one crease. I'm like,
yeah, you would have definitely ran off the table. So we know Jeannine by now, so we have to be very, very careful with her.
Right.
So let me go out and get a little bit more Botox, and then we'll do...
And, okay. So we'll be right back. You're watching Skin Sense. We're doing a procedure called Botox. Most of you have at least heard of Botox. Stay with us here. Again, if you want to see the procedure, I'm a chicken, and even I got it done, the Botox. First time ever I got something done that was cosmetic for my face. Go to ssptv.com. Also, my mom, Deb Lasant, got the procedure done. We'll be right back. If you want to look younger without a facelift, then Botox may be for you. We're here at DermDocs on Laurel Street in Hazleton, and we're doing the procedure with Dr. Steve Schleicher, and Dana is our patient. So where are we at now with the Botox? We're doing some...
Well, right now we did the forehead.
Okay.
Okay. And what we're going to do is these so-called crow's feet.
Okay.
Okay. And the question, of course, was asked about the price of Botox. Mm-hmm. Well, this is how Botox is packaged. It's packaged in these little vials, which the doctor actually makes up with saline. Okay. And again, this vial costs the doctor, close to $600 for this little tiny vial. Okay, and generally you can probably get about 3 treatments depending on what areas that you do per individual.
Okay.
And again, men usually require more Botox.
Okay.
And one of the things we could talk about too, Botox isn't just used for these lines here. Okay, Botox can be used for people who sweat excessively.
Okay.
It's called hyperhidrosis. And that can be a major problem and a major embarrassing problem, as we all know. Okay, people can sweat not only their underarms, but their hands and their feet. The best treatment for that condition is Botox. Now that's a little bit different. You need a lot more Botox. It is a lot more painful, especially if you're thinking of injecting 25 to 50 little tiny needles into your hands and feet. Okay, but it works tremendously. And believe it or not, it actually lasts longer than if you were doing it for purely cosmetics, okay? Usually when we inject the palms, soles, and the so-called axilla, the underarms, Botox lasts 6 months, sometimes even longer than that, okay? Again, it is somewhat expensive, but it is the treatment of choice for people with that, it can be a very embarrassing problem.
Okay.
So just to make those points clear, and then what we'll do are the so-called crow's feet, and we'll do this side. And the crow's feet, Dana really doesn't have too much in the way of crow's feet, but we'll show you what area we do. We do right here, and here, and here. Okay, and those are the areas that are done.
Not a flinch.
So, and with Dana, she has a little stronger musculature up here, so since we're here, I'm going to put a little bit more over here. And many times we'll do a V-shaped, injection point for the Botox. And that's basically what we're doing with Dana. And I'll step to the other side, and we'll do the crow's feet over here. There, there, there. And we'll put a little bit more up here. And we'll put a little bit more up here, which is great.
How far does that spread then, Doc? When you put in, because you're picking different points to put that in.
Yeah, that's a real good question. And basically, when you were talking about spread factor, that's one of the differences between Botox and Dysport or Dysport. Dysport supposedly spreads a little bit more than the Botox, which can be a plus or can be a negative. Okay, but where you see these little marks right here, about maybe an inch or so apart, sometimes less than that, that's how we judge how to put the Botox in.
Okay.
And a lot of times, of course, we mark this out just for basic, so you can see it on TV where we inject. Many times we don't have to do that, okay? We know exactly where the Botox is going to go in.
All right. How are you feeling, Dana?
I feel wonderful. Didn't hurt a bit.
Okay. And since you've had this procedure done before, what can you tell people out there who have never experienced Botox?
Well, first I would say don't be afraid to try it. Again, I'm an individual who has no fondness for needles, but as Dr. Schleicher had already pointed out, this is really such a very tiny needle, and there's really absolutely no pain involved, and the results are terrific. You'll be glad you did it.
Doc, some of the side effects could be some bruising. Have you ever experienced any of those side effects?
Personally, I haven't. I've been fortunate, but...
Yeah, and we can usually tell right away if someone's going to get bruising, okay? And if somebody, usually this area here, the blood vessels are very, very, very fragile and close to the skin. So when we do the Botox, of course, you try to avoid those blood vessels, but sometimes you can't see them, and you hit a little bleeder. And if she was getting a lot of bleeding, then we would use an ice pack Okay, there are certain preparations, some of them containing vitamin K, which are touted as actually helping to break up the bruising quicker. But the studies are plus and minus. So, you know, if you get a bruise, it'll last a week, and it's very easy to cover up. It's usually just a little tiny bruise.
And you said that you've had it before, but you've waited a year between. Can you see those wrinkle lines coming back, or what did you notice?
I definitely noticed the wrinkles coming back. And, you know, it's just that time of the year where you feel like treating yourself to something nice, so why not?
Exactly, I hear you. Ring in 2010 with a little bit of Botox and make yourself feel a little better about yourself. That's what it's
Yeah,
like.
and it's real simple. And a lot of times we do combine it with fillers. Okay, it's a very good mix. I like to do them on separate occasions. Okay, sometimes people have such thick folds here that the Botox alone won't get out the folds. Then we'll have them come back in 2 or 3 weeks, and we may put a little filler in there. And a filler, as we did on a previous show, which you know, is basically, we call it liquid skin. And we put that underneath, and we lift up that filler.
And it's funny because before, if you talked about this 10, 15 years ago, people really hid when they did a procedure done on themselves, and now it's really the trend, the hip thing to do is, you know, do Botox and have people know the procedures that you do.
That's
So
a very good point.
We've come a long way.
Well, really, it's a status symbol, okay, which is pretty amazing. But I mean, there are certain reasons for that. First of all, it's not very expensive. Secondly, it's a simple office procedure, so it doesn't entail the downtime. I mean, when we used to do CO2 lasers, which are basically doing a whole facelift with a laser, people couldn't go out of their house for 2 weeks. And before that, we would do dermabrasions, not microdermabrasions, but dermabrasions, where you're actually sanding down people's entire skin. Again, you can't go out of the house for 2 to 4 weeks because you look horrible.
Procedures in general have come a long way cosmetically.
Yeah, and on the horizon, well, you know sooner or later someone's going to come out with a longer acting Botox. So maybe you only need it once a year. That would be absolutely positively marvelous. Because we know when the fillers first came out in the 1980s, first filler was collagen. Everybody's heard of collagen. Well, they were able to put that in a test tube. The problem is collagen would only last 3 weeks. Well, now we have fillers that last a year and a half. That's huge, okay? And we know sooner or later that will happen with Botox.
Well, thank you so much, Jeannine, for joining us. If you want to see the procedure, like I said, done on, my mom was here, and you know, we try to get some different age groups for you to show you the before and after. You can go to SSPTV.com to see that special, and maybe some surprises, right?
Well, yeah,
Doc always likes to surprise me.
Yeah, and if you get your medical degree, you can practice on me.
How about it? Well, you know.
It wouldn't be the first time that people have, so why not?
Won't be the first time someone stuck a needle to you?
Yeah, to put it mildly, yeah, because of course we train doctors, so, you know, once in a while they get to experiment on me.
All right, just make sure that when you do get any procedure done, you check with your medical doctor, and you also make sure that you're going to someone like you, Doc, who is credible.
Right. Experience, experience, experience. When it comes to these cosmetic procedures, absolutely.
All right. Well, thank you, Dana. Thanks, Doc. Always a good time. This show will be rebroadcast here on Channel 13 and on SSP TV. Also, our next show coming up, we should say, just so everyone is aware of the new show that we are working on. What's our next topic?
Next topic will be microdermabrasions.
All right.
Okay, which is another exciting topic.
All right. So that's to come. Learn all about it right here on SSP TV. We'll see you next time.